Hi, today I'm going to talk about male sexual anatomy, and it's a very interesting and fascinating subject. I'm going to tell you a few interesting facts about male sexual body parts and how they function, how they work together, and how they play important role in male sexual health and overall well-being. How a man perceives his penis directly impacts on how he perceives himself, his self-image, his confidence, his behavior. And if man feels good about his body and especially his penis, it will have a positive, more likely to have positive impact in all other areas of his life. But the reverse is true too. On the flip side, insecurities about size, performance, or negative past experiences can lead to low self-esteem and confidence, low confidence. And it's not just affecting men in bedroom, but it can spread to other areas of his life. So if man struggles with self-doubt or insecurity, he will be affected by this feeling in all other areas of his life. But there is a silver lining. When man is confident in bedroom, it will be translated in other areas of his life, his relationships, his work, his achievements. So if man feels successful in one area of his life, it's more likely that he will feel successful in all other areas of his life. The truth is that penis is not just a body part. It's an extension of ego. It communicates with the brain and in turn shapes how brain operates. It's a vital part how man is functioning in life because it plays an essential role how he perceives this world, how he experiences this life and who he is. And despite the fact that it's so important, male sexuality is looked at with a lot of shame and negativity. And there is lots of misconceptions and wrong information about his penis. We humans, we should embrace our sexuality as one of the most valuable gifts because this is what defines us as humans. That's what makes us different from any other species that live on this planet. And sexuality, human sexuality, and I mean here not just men, I mean here women as well, is very much based on confidence, how we feel about ourselves, inside and out. It's important to celebrate who you are and to own your confidence. And of course, confidence comes from knowledge. So let's just look at the anatomical structure of penis. Let's start with the basics and the external parts of the male sexual anatomy. And the most prominent is penis itself, but penis consists of other parts that make them work together. Male sexual anatomy is presented by external and internal parts. So here on the picture you can see external parts, and the main organ of external presentation of male sexual anatomy is penis itself. Penis consists of the root that connects penis to the body, also the shaft that extends it out, and the glans, that is the sensitive part of penis. Also, penis has scrotum with testes, as you can see on the picture. And we're going to look at each individual part separately. Penises can be circumcised and uncircumcised. When penis is circumcised, it means that the foreskin of penis is removed due to religious or medical reasons. And when this foreskin is a very sensitive part of male body. And when this foreskin is removed, it makes gland exposed and it makes it less sensitive than when it's got foreskin. So we already looked at the outside external part of penis that is presented with root, shaft or body of the penis, and gland. Now let's look inside penis. So in this picture we can see what's happening inside male sexual anatomy. And we start with urethra. Urethral meatus is here. And then you can see that urethra stretches along the whole body of the penis and connects with bladder. Then the gland of penis is presented with the foreskin, and penis itself, the body of penis, is made of 3 cylinders: corpus cavernosum and corpus sponginosum, also known as spongy body. Also, you will see that penis has scrotum, that has testes, and also epididymis. From scrotum, there is a vas deferens cord, and also you will see seminal vesicles, prostate, and ejaculatory ducts, and also Cowper gland, very tiny pea-sized gland. And we're going to look at each individual part separately. If you look inside the body or shaft of penis, you can see that it consists of 3 cylinders. You can see it on the picture, 3 cylinders. Corpora cavernosa, 2 cylinders at the top, and spongy body. These cylinders are made of spongy tissue, and that allows the cylinders to be filled with blood during sexual activity. And the more blood supply comes to the cylinders, the stronger erection is. Also, in spongy body, you can see that urethra is located. Urethra is where, in normal circumstances, when penis is in flaccid condition without any active sexual stimulation, this is where urine passes through urethra. However, during sexual activity, when penis goes into erection, the way the spongy body operates is that urethra stays open. However, only sperm can go through urethra at that time, nothing else. Erection is a very complex process, and we're going to talk about it in more details a little bit later. But for now, I would like you to look at these pictures and see that penis is richly supplied with arteries and veins, and on the picture they are marked in blue and red colors. So in a flaccid penis, there is a balance between blood flow in and out, and the blood supply to penis is at its minimum, just to keep the tissue at its healthy level. However, during arousal, blood flow to penis significantly increases. Penis becomes more supplied with blood during sexual activity than heart. And as penis expands and hardens, veins that normally carry blood away from penis are compressed. This limits the amount of blood that can flow out of penis. So those cylinders that we talked about in previous slide, they're filled with this blood. And with more blood flowing in and less blood flowing out, penis enlarges and becomes fully erect. That's why it's very important to be in control of your pelvic floor muscles and understand the whole process, the whole mechanism of what's happening in your body during sexual arousal, during sexual activity, so you could control your erection in a better way. The scrotum is the pouch of skin and muscle that hangs beneath the penis, and contains the male gonads, the testes. So I'll show it to you on the picture. Circle it in red. So this is the scrotum. And it plays an essential role in regulating the temperature of the testes, which is crucial for the production and storage of sperm. And sperm production requires a temperature that is slightly lower than the body's core temperature. That is why scrotum hangs outside the body, away from the warmth of the abdomen. Scrotum helps to regulate the temperature of the testes through its ability to contract and relax. So when it's cold, the scrotum tightens, pulling the testes closer to the body to keep them warm. And when it's warm, the scrotum loosens, allowing the testes to cool down. And this process ensures the testes stay within the optimal temperature range for sperm production. Scrotum is made up of thin layer of skin and layer of muscles called dartos muscles, which is responsible for the wrinkling of the scrotal skin. And beneath the scrotum is the muscle called cremista, the cremista muscle. Here you can see it on the picture, it's marked in red. It helps raise and lower the testes in response to temperature and physical activity. And you can also train this muscle in order to control your sperm production. And this is something that we talk about in Erection Fitness, one of the programs that I run. Let's talk about testes or testicles. Testes are the male reproductive organs that are located inside the scrotum. And they have two main functions. The first one is sperm production. And testes contain coiled structures called seminiferous tubules. You can see them on the picture here. And these are the sites where sperm is produced. And this process is known spermatogenesis or sperm production. And it occurs within these tubules. The sperm then moves through a series of ducts and tubes to become mature and ready for fertilization. And then the second function of testes is hormone production, and they produce testosterone, the primary male sex hormone. Testosterone is responsible for the development of male characteristics such as deep voice, body hair, muscle mass, and also it plays a crucial role in regulating libido. So the higher level of testosterone, the higher level of sexual desire. And that obviously maintains overall reproductive health. If we look at the testes, we can see that they are oval-shaped and roughly the size of a small egg. They are soft but firm to the touch and are divided into compartments that house the seminiferous tubules. The testes are sensitive and should be handled with care to avoid injury, because if injury happens to testes, that can affect the level of testosterone production. Epididymis is a long coiled tube located behind the testicles. While it may seem small, it's incredibly important for sperm maturation. Think of it like a training ground for sperm where they go from immature cells to fully functional sperm capable of fertilization of an egg. If we look at the epididymis, we can see that it's divided into three main sections. The first one is called the head of epididymis here. That's where sperm enter from the testes. Then sperm continue to mature in the body of the epididymis as they move through the tube. And then you see the tail of epididymis. That's where sperm is stored and become fully mature and ready for ejaculation. So when sperm is produced in testes, it enters epididymis immature. But once it enters epididymis, it matures, and the process of maturity of sperm involves the change of sperm structure, and that allows the sperm to swim and to fertilize an egg. And this process might take about 2 to 3 weeks. So once sperm have matured, they are stored in the tail of the epididymis, and when ejaculation occurs, the sperm travel from the epididymis through the vas deferens and into the urethra, where they are released. So the important functions of the epididymis: first of all, it's sperm maturation, it's sperm storage, and sperm transport. And epididymis is the crucial part of the male reproductive system. It stores and matures sperm, ensures they are ready for fertilization when needed, and without a properly functioning epididymis, sperm would not be capable of performing their essential role in reproduction. So let's summarize. Scrotum. Scrotum holds and protects testes, and its primary function is to provide slightly lower temperature than the body, about -1 or 2 Celsius lower, and which is essential for the optimal sperm production. Then we have testes that are responsible for sperm production and male hormone testosterone. So they produce sperm through the process called spermatogenesis in the seminiferous tubulus, and testosterone production is crucial for the development of male sexual characteristics and also regulation of sperm production and general male sexual health and longevity. And then we have epididymis that is basically used in order to store the sperm, in order to provide sperm maturation. And also epididymis transports sperm from the testis to the vas deferens for ejaculation. And then as a result, we have healthy, mobile sperm that is able to fertilize an egg. Vas deferens, and this is the muscular cord that is marked on the picture in red color. And this cord connects testes and epididymis with the rest of the pelvis organs of male sexual system. So when sperm is produced in testes, it's stored and mature in epididymis. And then during contractions, when orgasm happens, mature sperm is pushed through this vas deferens cord to go through seminal vesicles, where it accumulates some part of the fluid that makes up the ejaculate, and then it goes through the prostate. Prostate contributes as well to the fluid, and then in the area of prostate it connects with the urethra. Urethra is the area or the tube that transports sperm to the outside world. And during the process of ejaculation, the neck of the bladder closes down. So the ejaculate does not go inside the bladder, because that can cause pain, and that is called retrograde ejaculation. So in order to avoid this, ideally, bladder closes down its entry and the ejaculate is transported to the outside world through the urethra. What is important to understand is that the ejaculate consists of 5% of sperm fluid created in testes. So it's about 200 to 500 million of spermatozoa, and it basically is produced in testes, stored and matured in epididymis. Then seminal vesicle contribute up to 75% of the whole fluid of the ejaculate. And then prostate gland contributes 30% of the fluid. Also, we have Cowper gland that produces over 1% of the total fragmentation of the fluid. So you can see the ejaculate itself has a variety of different types of fluids produced in different areas and different zones and pelvis organs of male sexual system. The ejaculatory ducts and seminal vesicles. So first of all, let's look at the seminal vesicles. As you can see it on the picture, there are two small glands located behind the bladder, and these are the seminal vesicles. And they are also above the prostate gland. So they produce a significant portion of the semen, about 60 to 70% of the semen. And the fluid they secrete is rich in fructose, which provides energy for the sperm. This fluid also contains prostaglandins that help in the contraction of the female reproductive tract to facilitate sperm movement. And then we move on to ejaculatory ducts. So they are formed by the union of the vas deferens, this cord that you're already familiar with, and seminal vesicles. And they run through the prostate gland and connect to the urethra. So the ejaculatory ducts transport semen, sperm and seminal fluid from the seminal vesicles and the vas deferens into the urethra. And this is basically the final passage of the semen before ejaculation. So they allow the sperm to mix with the fluids from the seminal vesicles and the prostate and then move to the exit through urethra. Cowper's glands are also known as bulbourethral glands. It's a pea-shaped glands or structures located beneath prostate and just at the base of the penis. And they play very important role in the male reproductive system. So the first role is pre-ejaculatory fluid. So they produce a clear alkaline fluid prior to ejaculation. And sometimes men confuse this fluid for ejaculate. But this fluid helps to lubricate the urethra and neutralize any acidic urine residues in the urethra, clearing a more favorable environment for sperm to travel through during ejaculation. And then this fluid also protects sperm by providing a smoother passage through the urethra, reducing potential damage from acidic conditions or frictions. Prostate gland. It's a small walnut-shaped gland that is located below the bladder and in front of the rectum in males. It surrounds the urethra, the tube through which urine and semen pass. Prostate plays an essential role in male sexual health. It's also called man's second heart, and it's got very important functions in male sexual activity. One of them is prostate produces a milky alkaline fluid that is a major component of semen. And this fluid helps to nourish sperm because this fluid has a lot of enzymes, proteins, and minerals that support sperm health and motility. Also, fluid that prostate produces neutralizes the acidity. So the alkaline nature of the fluid helps to neutralize the acidic environment of the female reproductive tract, protecting sperm and allowing it to live longer in order to fertilize an egg. And then it aids in ejaculation, because during ejaculation the prostate contracts, pushing the fluid into the urethra, where it mixes with sperm from the testes and fluid from the seminal vesicles to form semen. Prostate's location around the urethra also helps regulate urine flow. It contracts to prevent urine from entering the urethra during ejaculation. It's important to look after your prostate, because with time and due to environmental pollution and style of life that's currently happening with really low quality food and water and like I said, air pollution and stuff, prostate accumulates a lot of toxins, and a lot of men experience problem with prostate with age. But nowadays, not even with age, at any age they can experience problem with prostate. So there are important ways of looking after it in an alternative way. So one of them is obviously healthy diet and hydration, but also there is a prostate massage that I teach mainly women in one of my courses about oral sex and lingam massages, where I talk about the way how they can massage prostate in order to prevent from different issues that their men can have. Pelvic floor muscles play an important role in male sexual activity, contributing to various aspects of sexual function and overall pelvic health. One of these functions is erection control, particularly muscles. If you see on the picture, ischiocavernosus muscle and bulbospongiosus muscles. These muscles are important in the process of maintaining an erection, and they also support the blood flow to the penis and help maintain its rigidity during sexual arousal. During ejaculation, the pelvic floor muscles contract rhythmically to help propel semen through the urethra, and these contractions are vital for the force and control of ejaculation. The pubic coccygeal muscle, as you can see on the picture, is especially involved in the controlling the release of semen and can help delay ejaculation when strengthened through exercises like Kegels. And it's not just Kegels, there are many more things you can do with your pelvic floor. There are 5 very important, essential, powerful zones that every man should know about. And when you know how to activate the zones, you will never ever have any problems with your sexual activity, with your sexual performance, regardless of your age or circumstances. And these 5 powerful zones we cover in my program called Erection Fitness. So what else pelvic floor muscles do? They basically contribute to the sensations associated with orgasm. So the stronger pelvic floor muscles are, the more pleasurable sensations you would experience during sexual climax. And of course, pelvic floor muscles play a role in controlling urinary and bowel functions. And of course, strong pelvic floor muscles can help prevent issues like incontinence or premature ejaculation that can negatively impact sexual experience. And overall, Pelvic floor muscles are essential for erection maintenance, ejaculation, orgasm, and also providing urinary and bowel control. Anus plays an important role in male sexual health, both anatomically and functionally, and although it's primarily associated with the excretion of waste, it can also be involved in sexual pleasure and intimacy. So, anus is an erogenous zone, and it means that it contains nerve endings that can provide sexual pleasure when stimulated. In some men, anal stimulation, either through direct touch or penetration, can lead to heightened arousal or orgasmic sensations. Anal sex is especially popular between gay men. But another type of stimulation, especially when it comes to prostate massage, because of the location of the prostate, it's impossible to reach prostate through our ways rather than through anus. And stimulation of prostate can lead to pleasurable sensations, and it also can cause prostate orgasm as well. So some men, especially gay men, involved in anal intercourse, and it can provide very strong pleasure. Anal sphincters that control the opening and closing of the anus can play a role in sexual function. And for some men, it's the ability to control these muscles that can bring the sexual experiences and contribute to pleasure. And of course, it's important for pelvic floor health to have sphincters healthy and strong pelvic floor muscles that surround the anal sphincter in order to control different biological processes. So it's important, obviously, to understand the fact that anus is part of male sexual system, and it is actively involved in sexual activity and also in pelvic floor health. Did you know that in the first 6 to 7 weeks of fetal development, male and female embryos have similar genital structures? The genital tubercle will become either the penis or the clitoris, depending on hormonal signal. So if you look at clitoris and penis, you will see that they look similar and they're actually made out of the same tissue. But in males, the testes produce testosterone, which drives the development of the penis and scrotum. And the testes also produce the Müllerian-inhibiting substance, which causes the Müllerian ducts to regress and prevents the formation of female reproductive structures. In female, the absence of testosterone allows the genital tubercle to form the clitoris, and the Müllerian ducts develop into the uterus, fallopian tubes, and vagina. The absence of Müllerian inhibiting substance allows the female reproductive system to develop. So by around 8 weeks, the sexual differentiation of genitals is well underway, and the basic structure of the male and female external genitalia are distinguishable. The list of nicknames assigned to penis is quite impressive, but it's non-exhaustive. I'm going to give you the examples of the words that people use in order to address their penis. Apparatus, appendage, bat, battering ram, bone, bone pickler, cock, dick, dingling, dawn, engine, equipment, gadget, gladius, Guba, hook, horn, instrument, Johnson, John Thomas, joint, Jolly Roger, machine, manhood, manroot, member, mighty one-eye trouser, snake, organ, pecker, penny, peepee, pita, pisa, pistol, prick, pats, rod, Roger, salami, shlong, schmook, shaft, sing, third leg, tool, wang, weapon, wee, weak, winner, works, yard, and zapper. And of course, if you know more names, please put in the comments under this video. If you found this video interesting and educational, please don't forget to put like and subscribe to my channel to get educated in the field of human sexuality, relationship, and human sexual health and well-being. Remember that knowledge is power.